Mucus Relief Cough is a combination medication that helps to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin thins and loosens mucus in the airways, clearing congestion and making breathing easier. Dextromethorphan acts on a part of the brain to reduce the urge to cough. It's important to read the package instructions carefully before using this product, especially if you are self-treating. Cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some are not recommended for use in children younger than 12 years. Always follow dosage directions carefully to decrease the risk of serious side effects. Do not use this product to make a child sleepy, and do not give other cough and cold medication that might contain the same or similar ingredients. It's important to ask the doctor or pharmacist for other ways to relieve cough and cold symptoms. When taking Mucus Relief Cough, it is important to follow the directions provided by your doctor or on the product package. Make sure to drink plenty of fluids while taking this medication to help break up mucus and clear congestion. The dosage of Mucus Relief Cough is based on your age, medical condition, and how you respond to the treatment. It is important not to increase your dose or take this medication more often than directed. If you are using the liquid form, be sure to measure the dose accurately with a special measuring device/spoon. For powder packets, empty the entire contents onto your tongue and swallow. If taking capsules, swallow them whole to prevent a bitter taste. It is important to use this medication properly and not to abuse it, as improper use may result in serious harm. If your cough returns or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or worsens after 7 days, be sure to consult your doctor. If you think you may have a serious medical problem, seek medical help right away. Side effects of Mucus Relief Cough may include dizziness, drowsiness, nausea, and vomiting. If these effects persist or worsen, notify your doctor or pharmacist. Your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of side effects. Most people using this medication do not experience serious side effects. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of potential side effects, so if you experience any other effects, contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects, and report any side effects to the appropriate health authority in your country. As for the optimal timing and daily dosage of Mucus Relief Cough, follow your doctor's instructions for the best results. Before taking Mucus Relief Cough, make sure to inform your doctor or pharmacist if you are allergic to Guaifenesin or Dextromethorphan, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so talk to your pharmacist for more details. Before using this medication, let your doctor or pharmacist know your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This drug may cause dizziness or drowsiness. Avoid alcohol or marijuana, cannabis, as they can enhance these effects. Refrain from driving, operating machinery, or doing anything that requires alertness until you can do so safely. Limit alcoholic beverages and consult your doctor if you are using marijuana, cannabis. Liquid forms of this product may contain sugar and/or alcohol. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances in your diet, use caution and consult your doctor or pharmacist about using this product safely. The liquid forms and powder packets of this medication may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this medication safely. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is unknown if Guaifenesin or Dextromethorphan passes into breast milk, so consult your doctor before breastfeeding. When taking Mucus Relief Cough, it's important to be aware of potential drug interactions. This medication may interact with certain MAO inhibitors, so it's crucial to avoid taking medications such as isocarboxazid, phenelzine, or selegiline during treatment with Mucus Relief Cough. Additionally, it's important to check all medication labels to ensure you are not taking more than one product containing guaifenesin or dextromethorphan. Furthermore, guaifenesin may interfere with certain lab tests, so it's important to inform lab personnel and your doctors that you are using this medication. Always consult your doctor before starting or stopping any medications, and be sure to keep a list of all products you are using to share with your healthcare providers. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's crucial to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. It's important to follow your doctor's instructions when taking mucus relief cough. Do not share this medication with others, as it is prescribed specifically for you. Make sure to attend all medical and lab appointments as recommended by your doctor. This will help ensure that you are getting the most out of this medication and that it is working effectively for you. If you forget to take a dose of mucus relief cough, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at your regular time. Do not take 2 doses at once to make up for the missed one. When it comes to storing mucus relief cough, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid form of this medication. Different brands of this medication may have different storage requirements, so it's best to check the product package for specific instructions or ask your pharmacist for guidance. And as with all medications, be sure to keep it out of reach of children and pets. When it comes to disposing of mucus relief cough, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. It's best to consult with your pharmacist or local waste disposal company for the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.